Hello there, I am Mahalakshmi Rajesh. I am from class DTM2B, matrix number 33DTM20F1024. Today I will be presenting for my oral test. My topic for today will be eating disorder. Now, what is eating disorder? An eating disorder is a mental illness characterized by abnormal eating patterns that have a negative impact on a person's physical or emotional health. There are so many types of eating disorder. Let's look at the common type of eating disorders. Firstly, anorexia nervosa. It is a condition which a person does not eat enough to sustain normal body weight and experience fear related to gain weight or becoming fat. Bulimia nervosa. It is a condition in which a person binges, which means eating large amount of food in a short period of time and then attempts to avoid gaining weight by making herself or himself vomit, fasting or exercising excessively. And lastly, binge eating disorder. It is a condition in which a person binge eats but does not vomit or use other methods to prevent gaining weight after a binge. Let's look at the statistic of eating disorder. This graph on eating disorder shows the prevalence of these conditions. Although it may appear that eating disorders are not very common, they are serious, often life-threatening disorders. Individuals with anorexia and bulimia nervosa are at an increased risk for suicide, which is part of what makes eating disorder so deadly. Sufferers are also at high risk of dying from physical health complications. All eating disorders are associated with serious chronic health conditions. For these reasons, early identification and intervention are the key to recovery, and those who are suffering and seeking treatment should be assessed regularly for suicide risk as part of treatment by a qualified mental health professional. Sufferers should be also followed by a medical doctor who is familiar with eating disorder. About 9% of women and 3% of men will develop anorexia nervosa in their lifetime. This disorder is most common in young women, and in any given year, about 0.4% of young women will be diagnosed with anorexia. Anorexia nervosa often develops in response to a stressful life event such as going off to college, though many other factors play a role in the development of anorexia nervosa. As for bulimia nervosa, occurs more frequently than anorexia nervosa. 1.5% of women and 0.5% of men developing bulimia in their lifetime. In any given year, 1 to 1.5% of people will be diagnosed with bulimia nervosa, and this disorder is more common in women, but men develop bulimia more often than anorexia. As for binge eating, as you can see from these graphs on eating disorders, binge eating disorders is the most commonly occurring eating disorder, with 3.5% of women and 2% of men diagnosed in their lifetime. In any given year, 1.6% of females and 0.8% of males will be living with binge eating disorder. Binge eating disorder is a common among women for racial or ethnic minority groups as for white women, binge eating disorder is often seen in people with severe obesity, and up to 30% of people seeking bariatric surgery or other interventions for weight loss are suffering from binge eating disorder. However, binge eating disorders occurs in normal weight, overweight, and obese individuals. Furthermore, The causes of eating disorder, mostly irregular hormone functions, poor self-esteem, family and childhood traumas such as childhood sexual abuse, severe traumas, and also culture or peer pressure among friends and co-workers. As for the effects of eating disorder, most commonly effects such as muscle weakness, constipation, faintness, and reduction of bone density, or we call as osteoporosis. Continuing with treatments, firstly, medical care and monitoring, or we usually phrase them as hospitalization. Mostly extreme cases are admitted for severe weight loss, and the feeding plans are used for nutritional needs. For patients who refuse to eat or the amount of weight loss has become life-threatening. Secondly would be therapy. Therapy allows a trusting relationship to be formed. There are several different approaches can be used, such as cognitive behavioral therapy, CBT, which focus on personal thought process, interpersonal therapy. This therapy will address relationship difficulty with others, and rational emotive therapy, which focus on unhealthy and untrue beliefs. Thirdly, medicine. Medication can be used for the treatment of depression or anxiety that coexist with the eating disorder, and it also encourages weight gain. Drugs may be used with other forms of therapy, such as antidepressants. It will suppress the being purge cycle, and it's also destabilize the weight recovery. Lastly, let's get into the conclusion. In the nutshell, eating disorders can be fatal, with up to 10% of persons who develop them dying as a result. They can also cause a great deal of mental anguish as well as serious physical problems, as the eating disorder consumes time and energy, causes self-absorption, and lowers self-esteem. Important connection deteriorate. Treatment should be begun as early as possible, with a focus on the individual's present distress and the goal of assisting the patient and family in becoming powerful enough to overcome the eating disorder. And that's all from me. Thank you so much.